A sitting congressman just said that millions of Social Security recipients should stop collecting benefits and go back to work instead, and his solution might shock you. In the next few minutes, you'll discover exactly what Representative Mike Collins is proposing, why this could affect every American planning for retirement, and the real consequences if these ideas become policy. Stay until the end, because I'll reveal the hidden truth about what's really driving these proposals and how it could impact your financial future. Welcome to Financial Area, where we break down the policies and decisions that directly impact your wallet. If you want to stay informed about changes that could affect your retirement and financial security, hit that like button and subscribe for more content like this. Representative Mike Collins from Georgia has made headlines with a proposal that's sending shockwaves through retirement communities across America. His argument is straightforward but controversial. Social Security and Medicaid beneficiaries should return to work instead of relying on government assistance. But here's where it gets interesting. His proposed solution is to lower taxes, believing this will incentivize people to leave their benefits behind and enter the workforce. Collins isn't just throwing out random ideas. He genuinely believes that reducing government assistance dependency will strengthen both individual lives and the overall economy. His logic follows a simple equation. Lower taxes equals more take-home pay, which should theoretically make working more attractive than collecting benefits. On the surface, this might sound reasonable to some people, especially those who have never had to rely on Social Security for survival. But let's talk about who we're actually discussing here. Social Security isn't just handed out to anyone who asks for it. The program serves several distinct groups of people. First, you have retirees who've worked for decades and paid into the system, expecting to receive benefits when they reach retirement age. Then there are disabled individuals who physically cannot work due to medical conditions. There are also survivors of deceased workers, widows, widowers, and children who depend on these benefits after losing a primary breadwinner. According to recent data, over 67 million Americans receive Social Security benefits. That's roughly 1 in 5 Americans. Among these recipients, about 46 million are retired workers, 9 million are disabled workers, and the remaining are dependents and survivors. These aren't people lounging around choosing government assistance over work. These are individuals who either can't work due to age or disability or have already put in their time and earned their benefits. The political reactions to Collins' proposal have been swift and predictable. Progressive lawmakers immediately criticized the idea, pointing out the fundamental misunderstanding of who receives Social Security and why. Advocacy groups for seniors and disabled individuals have called the proposal cruel and out of touch with reality. However, Collins isn't alone in this thinking. Similar proposals have emerged from various conservative politicians who view government assistance programs as obstacles to economic growth rather than necessary safety nets. Now, let's examine why this proposal doesn't hold up under scrutiny. The biggest flaw in Collins' argument is that it completely ignores the physical realities of why people receive Social Security benefits in the first place. Take a 68-year-old construction worker who's spent 4 decades doing physically demanding labor. His joints are worn out, his back is shot, and he can barely walk up a flight of stairs without pain. Are we really expecting this person to return to construction work because taxes got lowered by a few percentage points? Or consider someone receiving Social Security disability insurance because they have multiple sclerosis, severe arthritis, or are recovering from a major heart attack. These aren't lifestyle choices. These are medical realities that prevent people from maintaining steady employment. No amount of tax cuts will suddenly make a person with advanced Parkinson's disease capable of working a full-time job. Then there's the age discrimination factor that Collins' proposal completely overlooks. Study after study shows that older workers face significant barriers when trying to find employment. Many employers, despite legal protections, still harbor biases against hiring older workers. They worry about higher healthcare costs, assume older workers are less adaptable to technology, or simply prefer younger employees. A 65-year-old looking for work isn't competing on a level playing field, regardless of how much their taxes might be reduced. The economic logic behind the tax cut incentive is also fundamentally flawed. Most Social Security beneficiaries are living on fixed incomes that barely cover their basic needs. The average Social Security benefit is about $1,900 per month, hardly a luxurious lifestyle that people are choosing over work. These individuals aren't sitting around calculating whether a tax cut makes work worthwhile. They're trying to figure out how to pay for groceries, medications, and housing on an extremely limited budget. Furthermore, many Social Security recipients who are physically able to work are already working. About 20% of people over 65 are still employed in some capacity, often because their Social Security benefits aren't enough to cover their expenses. The idea that tax cuts will suddenly motivate millions of people to abandon their benefits and enter the workforce shows a complete disconnect from the economic realities these individuals face. The unintended consequences of implementing such a policy would be devastating. Imagine forcing people who physically cannot work to seek employment or lose their benefits. We'd see a massive increase in homelessness among seniors and disabled individuals. Families would be forced to become caregivers for relatives who can no longer support themselves, putting enormous strain on working families who are already struggling financially. Healthcare systems would be overwhelmed as people who lose their Medicaid benefits suddenly can't afford medical care, leading to more emergency room visits and worse health outcomes. The economic ripple effects would be felt throughout society as consumer spending drops when millions of people lose their primary source of income. But Collins's proposal isn't happening in a vacuum. It's part of a much larger conversation about the future of Social Security that every American needs to understand. The Social Security Trust Fund is facing serious challenges. Current projections show that if no changes are made, the trust fund will be depleted by 2034. When that happens, the system will only be able to pay about 77% of scheduled benefits, which means a 23% cut for everyone receiving Social Security. This looming crisis has politicians proposing various solutions, and they fall into two main categories. Some, like Collins, advocate for reducing the number of people receiving benefits or cutting the amount of benefits paid out. Others propose expanding the program by raising the cap on Social Security taxes or increasing benefits to help people afford the rising cost of living. The retirement age debate is another crucial piece of this puzzle. Currently, full retirement age is 67 for people born in 1960 or later. Some politicians are proposing to gradually increase this to 70, arguing that people are living longer and can work more years. But this ignores the reality that many jobs are physically demanding, and not everyone can work into their 70s. An office worker might be able to continue working at 70. But what about a roofer, a nurse, or someone who works in a factory? The political visions for Social Security's future couldn't be more different. Conservative politicians often frame Social Security as an unsustainable burden on the federal budget, arguing that cutting benefits or raising the retirement age is necessary for fiscal responsibility. They tend to favor means testing, which would reduce or eliminate benefits for higher-income retirees. And they often support privatization efforts that would allow people to invest their Social Security contributions in private accounts. On the other side, progressive politicians argue that Social Security is not just a government program. It's a promise made to workers who paid into the system their entire careers. They advocate for expanding benefits, especially for lower-income retirees who rely heavily on Social Security for survival. They propose lifting the cap on Social Security taxes, which currently stops at about $160,000 in annual income, so that wealthy individuals pay Social Security taxes on all their income, just like everyone else does. Understanding these competing visions is crucial because the decisions made in the next few years will determine what Social Security looks like for current retirees and future generations. If you're currently working and paying into Social Security, these policy debates will directly affect how much money you'll receive when you retire and at what age you'll be eligible to receive full benefits. So, what can you do about this? The most important step is staying informed and engaged in the political process. Research where your representatives stand on Social Security issues. Do they support expanding benefits or cutting them? Do they want to raise the retirement age? Are they committed to protecting the program, or do they view it as an obstacle to economic growth? When you vote, consider candidates' positions on Social Security as seriously as you consider their views on any other issue. Remember that Social Security isn't just a program for other people. Unless you're planning to work until you die, you'll likely depend on these benefits at some point in your life.